All the secondary student, we will see the new chapter, Opioid Analgesic. Opioid Analgesic. So what do you mean by the analgesic? Analgesic are the drug which relieve the pains. Which relieve the pain. The pain, they act by the CNS or the pain relief. Analgesic are the drug which relieve the pain, but they act on the CNS or peripheral pain mechanism without leading to loss of consciousness. That is the analgesic are the drug which relieve the pains by the acting on CNS or peripheral pain without leading to loss of consciousness. Now the pain is subjective phenomenon. Pain is subjective phenomenon. And it should be vary according to their situation. The pain should be vary with their situation. Now pains is a subjective phenomenon, and pains is a vary according to that's a situations. According to their ability of the pain, it should be mild, moderate, or severe pain. The pain can be divided according to the relief of the pain in the body. It should be first mild one, moderate, not less and not high, then severe pain. Analgesic can be divided into two type or two groups. First, opioid or narcotic analgesic. Second, non-narcotic analgesic or anti-pyretic, anti-inflammatory analgesic. Okay. Now as per that, the analgesic, the pain care analgesic can be divided into two types as per basis of the pains. That is, first, opioid narcotic analgesic. It is used for the severe pain, post-operative and the post-operative or pre-operative pains, severe pains. Non-narcotic analgesic, it also called as the anti-inflammatory and the antipyretic. It's a common tablet are used in the room at home. You can use Saridon, Crocin, ibuprofen, paracetamol, aspirin. These are used in such a category. Now, analgesic. The new chapter is opioid analgesic. Now we will see the new chapter, opioid analgesics. The opioid analgesics is naturally occurring naturally or it should occur naturally or synthetic drug that has been obtained by the morphine in this group. They are having the natural or synthetic drug that has a morphine. The all pharmacological action fall this in this group, the morphine. The analgesic of this group is morphine is the first analgesic. Analgesic is a opioid analgesic of this group is a morphine is the first analgesic. The first analgesic of this group. It is obtained from morphine. It is obtained from opium. You know it's very well. Opium is a ban for cultivation. In Marathi you call as ganja. Then they use for the pains. They also having the good property by the analgesic. Simultaneously they are having the good sedation, sedative and hypnotic property. They are having the good analgesic effect. Along with that they possess the sedative and hypnotic activity. The upper analgesic can be classification. Of the classification of upper analgesic is given into divided into two groups. Right? The first group, natural opium, alkaloids, opium contain two group of alkaloids. Opium contain two group of alkaloids. They are again divided into two groups, right? A group, that is phenthylene derivative, example morphine, well known, you know. Then second, codeine, it is act as an antitussive, codeine phosphate. Second group, B group, is a benzyl. The benzyl isoquinoline derivative. Example, papaverine, noscapine. Now see the classification. The upper analgesic is divided into two groups. The first is the natural opium alkaloids. The opium contains the two group of alkaloids. That is the main two group of alkaloids. Which are the two groups? These are phenanthrene and the benzyl isoquinoline. Phenanthrene derivative example is naturally occurring analgesic narcotic morphine and the codeine. Now morphine are used for the post-operative, codeine are used in the antitussive. Benzyl isoquinoline derivative second group is contain papaverine and the noscapine. Now the second group, second group, that is a semi-synthetic opiates. There is example commonly used the big heroin in the big society. Phyllocodeine. Second example, oxymorphine. Hydromorphine. And synthetic opioids. The synthetic derivative of opioids, the pethidine, is commonly used for in the pregnancy, post-operative pain, severe pains. Fentanyl and methadone, another example of the synthetic. That is, natural opium alkaloids are morphine. That is, in this group prototype are used in the pharmacology. There are the first action on pharmacological action. First action on CNS. The opioid show the mixture of stimulatory and inhibitory effect on CNS. The opioid show the mixture of stimulatory and inhibitory effect on the CNS, and the opioid is act on opioid receptors. There are 4 types. First, mu. Second, kappa, known as kappa. Third, sigma. And fourth, delta. They are the 4 receptors. Opioid acts in the opioid receptor, mu, kappa, sigma and the delta. They produce the action. They produce the stimulatory or inhibitory action. The main effect are, now the main effect are, first, they produce analgesic, analgesia. The morphine is most potent analgesic. After administration, within 20 minutes after administration, it relieve the pains by changing precipitation of the pain. Now it produce drowsiness and change in the mood. That is an adverse effect. They cause this effect, drowsiness and the change in mood. They produce the adverse effects. It is used for visceral pain. Visceral pain means that pain, it should be unbearable pain, not bearing the capacity, beyond the capacity pain. People may be the cry, that visceral pain, deep pain, For example, break down the bones, such a pains, that pains is called the visceral post-operative pains. After the operation, pre-operative pains, they are used. Now second effect, sedation. It is a common, it commonly produces the sedation, hypnotics and sedations. The high dose cause the sleep. You can use the high dose of morphine. High dose cause the sleep and even leads to the coma. Even leads to coma. It has no anticonvulsant activity. No anticonvulsant activity. It causes the, it has having the claiming effect. It causes the loss of apprehension, fear, dar. It can be lots, and it leads to an ability to concentrate and it leads to inability to the concentration. And intravenous is give, it causes euphoric effect, abhas, euphoric effect. It may be called as abhas. You can feeling all these things. That's why see how they produce the sedation. The morphine causes is a sedative effect. The high dose causes the sleep, which may leads to the coma. It does not having no anticonvulsant activity, and it's having the claiming effect. Cool. And it causes loss of apprehension and leads to ability to the concentration, and leads to inability, not ability, inability to the concentration. And intravenous it is given morphine, they causes the euphoric side effects. Okay. Now the next, respiration center. See, respiratory center. It produces depression of respiratory center and decreasing the sensitivity of respiratory center to the carbon dioxide. It produce depression of the respiration by depressing the respiratory center and decrease sensitivity of respiratory center to carbon dioxide. This drug is directly depress the respiratory center, depression by the respiratory center, and which decrease the sensitivity of to produce the carbon dioxide, a sensitivity respiratory center to the carbon dioxide. In the man, death due to the death due to morphine poisoning, morphine poisoning due to respiratory failure. Due to respiratory failure, it depresses the cuff center. It depresses the cuff center and thus act as antitussive, and thus is act as a antitussive. It is used in treatment of cough. Cough is so many type of the dry cough, wetted cough. Okay, now it's generally the allergic and depress the respiratory center and they act as a antitussive. The last main action is temperature. One is remain temperature regulating center. Morphine depress this center is temperature center is depressed by morphine. Temperature center is depressed by morphine and cause hypothermia. Temperature goes below normal, that is called hypothermia surrounding the cold. Okay, now the next section is emetic action. Emetic action. Morphine produces nausea and vomiting. Due to stimulation of CTZ, that is called the chemoreceptor trigger zone, that center responsible for produce the nausea vomiting. Morphine stimulate the CTZ and they produce nausea and vomiting. Then also is a side effect, they can develop the tolerance. Tolerance is developed for long use. Okay. Another action next is the pills. Due to the central action, which cause meiosis, that is contract the pupils, that is called the meiosis. But topical application, when the topical application does not produce no meiosis. Important, topical application of the morphine not produce the meiosis, but centrally action is caused produce the meiosis. Now another second. Now effect on CVS. Therapeutic dose. Therapeutic dose of morphine no much effect on the CVS. Therapeutic dose of morphine not have the much more effect on CVS. The fall in the blood pressure occur. Fall in the blood pressure. Fall in the blood pressures occur due to the vasodilation effect. Vasodilation by histamine release. Okay, now see action on morphine CVS. The therapeutic dose not have much more effect on CVS. Nothing is happening, but fall in the blood pressure is occur due to why? The vasodilation effect by releasing the histamine, and they cause the fall in the blood pressure after taken the morphine. Okay. Now third important action, GIT. The morphine reduce the peristalsis movement. The peristalsis movement means contraction, relaxation of the intestine. They are contracted, and the relaxation of smooth muscle of the intestine, and the food material goes to the forward. That natural movement of the intestine is a contraction, relaxation, that is called the peristalsis. When you can take the morphine, they reduce the peristalsis movement and increase the tone and increase the tone of GIT, gastrointestinal muscle, and as a result movement of GIT content is delayed causing more absorption of water. Then there is blockage of normal defecation. There is blockage of normal defecation, reflex, and increase the tone of anal puncture. All these three factors cause constipation. The morphine having most adverse effect is the constipation. How they are produce the constipation? The first, morphine you can take, they reduce the peristalsis movement of the GIT smooth muscle tone is increased. Then what happen in the finally the result, they contain delayed the absorption delayed. There is a movement of GIT content is delayed, then delayed due to that cause the more absorption. When the water absorption in the GIT in intestine, water should be the absorb. What happened now? They blockage the defecation means fecal matter removed from the body. They blockage that defecation. That is important. Fecal matter is not removed. They are stagnant in the intestine. Peristalsis movement is decreased, stagnant. Water is first factor. Water is absorption. Second factor is defecation, and the third factor, all the reflexes, intestine and the anal pincher and reflexes, all should be the increase, and that is the third factor. And then all these things, first factor peristalsis movement, second factor delayed absorption, third factor defecation. These three factors, and they increase the tone of anal pinchers, and they block reflex there, and they cause the constipations. There is a major adverse effect. Always ask the reason why the morphine caused the constipation. Explain these two. Okay, complete. Now last, pharmacology. Smooth muscle. Barre. Smooth muscle. The morphine produce plasm. Most of the smooth muscle. Okay, and morphine constrict the constriction of bronchi, smooth muscle, due to the release of histamine. Okay, are you understand? Which it is not never used in the asthmatic patient. Stop.